Hi, Anil.
Hi, Danny.
So I'm Danny. I'm from the Link, and I'm going to be interviewing Anil here from Singapore. So for the first question, Anil, so in the past decade, what do you think are the most significant advances in stroke care and neurointervention that has happened in Singapore?
Well, I must say that Singapore was one of the few countries in the region who had planned for this quite well in advance. All the way from 2008, 2009, we had an service in place for acute endovascular recanalization for acute ischemic strokes. To address, at that time, of course, we were just 3 or 4 interventionists in Singapore, and we had planned for something like a national on-call cover, where we used to cover all the hospitals. Like one person will be on call for all the 3 hospitals, and we would provide. This way, we could ensure that we could provide a 24/7 cover, 365 days a year without stressing everyone. It was manageable until 2015 or so, and then the volume started exploding. We had to actively start training more physicians. We started training neurologists and neurosurgeons as well. In the past, it was only radiologists doing it. So I think that was one of the big changes that we started making it a bit more multidisciplinary participation, neurointerventional care after the volume started exploding with stroke EVTs on the scene.
All right, that sounds like you have a good government healthcare that is able to coordinate all the hospitals because not all countries have that.
Indeed.
Okay, Anil. So, given the rapid growth of neurovascular technology worldwide, how do you see this affecting what you have in Singapore?
Yeah, I fully agree with you. The technology is changing rapidly, and we are quite fortunate that we are practicing in an era where new technologies and neurointervention is emerging almost every day. It's like we are spoiled for making choices. Amongst all the new things that have been emerging, I find transradial access and related developments to be most exciting, because the impact from that is not just to the patient but also to the entire healthcare system. It makes, we are living in a world where there is increasing emphasis on value driven outcomes, and transradial access has a big role to play over there. Today in my practice, almost 80% of diagnostic angiographies are done through a transradial access. More than 50% of elective aneurysm and AVM work is done to a transradial access. Stroke is the only area where still more than 90% is done to a transfemoral axis. And one of the beauties of having a transradial access is that it allows us to mobilize our patients early, send them home early, and this has a big impact. The longer a patient stays in the bed, the longer a patient stays in the hospital, higher is the cost to the healthcare system. And by reducing the overall cost to the healthcare system, we can actually benefit our patients and the entire system much better. And I think, yeah, that's where we hope there could be more developments coming, especially with respect to stroke thrombectomies, because the current generation of devices are not very compliant for using through a transradial access, especially for our Asian patients who are of a slightly different stature compared to the Western audience.
All right, no, very well said. So, thank you again for
Thanks,
giving me
Johnny.
your time. And I hope to see you next year at Link Singapore.
Same here.